The Vampire Facelift is a new treatment that Dr. Strawford's doing, which is really good for the loss of volume in the face and texture for the skin. So I'm quite excited to be having it today.
What is the Vampire Facelift? Well, some of you may have heard about this. This is the latest craze, is it, from America, from Hollywood? Certainly there are stars out there such as Angelina Jolie and Kim Kardashian that are all purporting to have had fantastic results from the Vampire Facelift. The Vampire Facelift, however, is derived from real science. It's a system of treatment that was developed by Charles Reynolds in the United States a few years back, and involves injecting PRP, or platelet-rich plasma, which contains growth factors that regenerate and stimulate tissue such as the skin and underlying structures.
I've chosen to have it done. I've had treatments in the past, the occasional filler and Botox treatments, and with Dr. Strawford, and Dr. Strawford's recommended that I have this treatment today. I fully trust Dr. Strawford to be doing this.
So I'm just applying, Paula, a small amount of a very potent local anaesthetic cream. It will just mean it's nice and numb on the skin surface when I do the vampire treatment. Once we've got your blood prepared in about 20 minutes time.
Okay.
There's plenty of science around PRP. It's been used in medicine and surgery for many years now. Effectively, platelet cells are cells in our own body that are therefore helping to restore and repair damaged tissues. Platelet cells contain growth factors. In fact, there are 20 different growth factors within platelet cells. Effectively, what we're doing with PRP is we are able to take some blood from you. We're then able to extract the platelet cells and activate them to release the growth factor, so that when we re-inject that back into the body, in this case into the face, then we will stimulate a very profound regenerative process. So it's effectively a very natural process, a process of healing and restoration. One of the advantages of the Magellan True PRP system that I'm using today is that I can take large volumes of blood, unlike other systems that are available. And from the ability then is to be able to separate a much larger volume of the platelet-rich plasma than I would get with any other system. So we're loading the first syringe of blood into the Magellan True PRP system. The system's just starting up through a process of a very gentle centrifuge in the first instance, just to start to separate the cells. So a key part of the Vampire Facelift is to use very small amounts of a dermal filler, usually a hyaluronic acid filler, which is a filler that we use regularly in aesthetic cosmetic medicine. I'm not using large amounts like we may use to do a full correction, but what I'm using is putting very small amounts of the HA filler into targeted areas to allow the PRP to attach around the HA filler and remain in a high concentration in that area, which will then stimulate volume regenerative changes in that area. With the Vampire Facelift and Vampire Facial, it's a gradual regenerative process. So over the first few days or weeks, you might see a general improvement in the skin condition, a little glow of the skin. It's often called the vampire glow. The colour of the skin might be improving. Over time, and it can be a number of months, the regenerative process really takes hold, and we'll start to see an increased collagen production, a plumping of the skin, the volume restoration in the areas that we've placed the filler with the PRP, and a general improvement in the skin. The complexion improves, but so does the tone and quality of the skin. So fine lines and wrinkles will gradually diminish. So I'm just finishing off now the PRP. Just small amounts of the platelet-rich plasma. So I'm going to now use the injector gun. This is a needle concept mesotherapy gun that allows me to inject tiny amounts, very small volumes, directly into the dermis and just beneath the dermis. So it allows me to do relatively pain-free intradermal injections, but also I can, as you'll see, do a rapid fire needling of the skin. So the needling of the skin causes micro traumas, little tiny channels in the skin, if you imagine, that actually then encourages the body to use the growth factors and the platelet cells to regenerate, and that's part of the process. If we just put it on the surface, then the PRP would have no real benefit, but certainly by an injection technique over the skin, then we will get a profound stimulation of the skin. As many of you might have seen of the Kim Kardashian Vampire Facelift, is that there is some of the PRP on the surface here. So it does look like we're smearing Paula with blood, but that's not actually the case. We're actually just, a small amount of PRP is on the surface, and that will slowly absorb through the little tiny holes that I'm making with the meso gun. There's really very little downtime after PRP treatments. The initial stinging and uncomfortableness passes off very, very quickly. And certainly most patients leave the clinic looking much better and refreshed. In certain situations, we may give you some of the platelet poor plasma serum to go away and continue to put this on your skin for a few hours. Often people have seen videos of Kim Kardashian with blood on her face. This is in fact the serum that she's applying post-treatment, which continues to work for a number of hours. By the next day, most patients are completely normal and back to their normal activities and work without any evidence of them having had any treatment. So, lovely to see you again, Paula.
Hi, nice to see you.
And it's been 6 weeks since you had your Vampire Facelift.
Yes.
Yes.
Yeah.
Okay. Tell me how it's all been going.
Really well, actually. A couple of days afterwards, I felt like I couldn't move my face my facial features as normal, but that didn't take long to go. And yeah, I think my skin looks really radiant, a lot smoother. The texture's a lot smoother. So I'm really pleased.
I can see that the skin, that you've got that glow. We call it the vampire glow. It's because the PRP stimulated in the skin at all the different levels. You do get a quality improvement and a glow of the skin. Some of it is as well the new blood supply that the skin's getting. That gives a healthier glow to the skin as well.
Yes.
Okay.
Yeah.
But I can see what's really nice is you're starting to get some lovely volume in your cheeks. The skin quality is improving. I think where we worked underneath the eye, the skin is starting to look a lot better underneath the eye, where you have quite thin skin naturally.
Yes.
So again,
yeah, a lot smoother, is it, under
and
the
it
eyes?
looks really nice along your jawline here.
Yeah.
And certainly that's looking a very nice natural result, and one that will continue to improve.
Yes.
So the stimulatory effect continues. It's 6 weeks now. I suspect for the next 2 or 3 months you may continue to see some improvement, and then that improvement will, because it's your own regeneration of tissue, that will continue to stay there for a good long time.
Brilliant. No, I'm really pleased.
Before you may need to consider any other treatments.
Yes.
In that area.
Okay.
Yeah.
Great. Thank you.
Okay.
Yeah, really good.